Where are these bags? 4. Two more and then we're done. We got 4, 1 of them. For sure. Good to see you. Bye.
Yeah, I don't think they make one that doesn't.
That's what I brought for lunch. I ate my lunch because like I didn't eat breakfast.
So let me know. I got 4 hard-boiled eggs in my bag.
Hi y'all, we're live again, so if I
All heated up.
My lunch became my breakfast.
Got cheese in there. Hard-boiled eggs. This is good, man.
Yes, please, Matt. Keep telling them.
So there's like little cameras that are kind of everywhere, so that the other students know what's going on. So please speak up. I will remind you, but there's no one around me. So we are headed currently for a 30-year-old male that was on a motorcycle and hit a deer. There really isn't much more information from this past from that. EMS is not out of scene just yet. They were still headed there, so we don't have any short. So we'll grab what we want out of the aircraft. We'll take the COX off of this. But we can take whatever we want out of here. Dear Mom. Just available to the records right now. See there? This be already.
That takes so long. Good choices.
But I didn't check.
This and our monitor.
The computer was there. Hey,
hello.
Glad you guys are here.
I'm Zane, this is Carly.
Right.
What have you got for us?
Passerby called in, has 32-year-old male, motorcycle versus deer, no helmet. He's cold. He's got 2 lines started on him, bagging him. Got a pressure of 70 over 44.
Got no PA in.
Last just known about him was he texted his wife last night about 8 o'clock, and that's been it.
Okay. Was the motorcycle cold?
Yes, he was very cold.
Bagging okay with an OPA.
Alright. We'll switch to something just a little bit more stable. Said you got lines going. Have you given any fluid or anything?
250 bolus of saline.
250.
Pressure was so far.
I tried to go see if it was better. It's probably okay, just give us something to see.
Alright. Looks like we've got a heart rate of 130, SpO2 is 91 with a good waveform, and your blood pressure is 85 over 40.
Okay. You want to keep bagging for us?
Keep bagging, yeah.
Sure. Just gonna hold on to that too. Is that a pool of blood?
Yeah,
he's
it looks
got-
pretty messy over here.
I didn't see that from this side. Get a tourniquet on that leg.
I don't remember.
Okay.
It's my first day back from vacation. There's a lot more blood up there too.
You guys got your trunk equipped.
No, we don't.
Not having gas back there with. Get this addressed. Is there anything spurting or
Doesn't look like it.
just exactly what I see? There we go.
Just a lot. Here.
Just turn this and just get some water. So feel that breathing's under control. Haven't been nice and soft.
Yeah, which is what you get on there.
Just with the baseline, we'll go through. Let's get him on your phone. Are you ready?
Mhm.
1, 2, 3. Appreciate you guys getting some IVs first. All right.
Mhm.
1, 2, 3.
Zane, where would you like to sit?
I will take the airway. you want this door shut for some?
Nah, that's all right. Pulling back to you so I can do some work here.
Sure.
Got no patience. Pulling back.
Pulling back, sorry. Misunderstood you.
There we go. Now, what do you want?
Get some blood hanging. Like you want to grab the gauze.
Some
Over in
gauze.
that corner.
Right. Alright. Here's the blood stuff. I can keep doing this if you put that together for me. I didn't read my Fun Fact Friday, so I don't know how to do it.
Fair enough. So we'll start with plasma. Make sure we have good flow before we go. Hooking them up to it.
There's a towel by your right knee if you want to dump it in that.
Sure.
It's a little slippery out there.
Okay. Is perfect.
Ready?
And the battery's up, so that's fine.
There. That sounded like a clique of champions. Alright. I'm gonna give you the bag back.
Sure.
Got it.
It's not on yet.
Okay. Alright, blood is connected.
Sweet. Let's get ready to intake. Actually, we haven't had any responses out of him. So he's got GCSO3.
Yeah, I'm sorry.
Since he's accepted 2 things down his throat without vomiting, honestly, I think a GCSO3 is going to be an adequate sedative.
Okay.
Just want his airway under control.
You want me to bag?
If we could actually get this bag on some oxygen, that'd be great.
Let's go with yes, it is on there.
Okay, 15 liters.
15 liters of O2, got it.
So I considered TXA, but since he's been out there for so long and everything's cold, it's probably been too long for TXA.
Okay.
Creating more of a risk for DIC. Checking how cold it is. We're probably already there.
Alright, okay, that's valid. Why he was riding a motorcycle in the snow, I don't know.
Going on at 25 or whatever flush is for these ones. Should be 15, it looks like. Get you some cap and go.
Okay.
Plug that in. Thank you.
CO2 is on.
don't see the waveform yet.
I think it will be coming shortly. You are getting some sort of reading as far as like it's in there, right?
Okay.
Or you know what I mean.
So it's all this head wound that doesn't look like it's currently actively bleeding.
Okay.
Back here. I'm seeing it using.
All right.
7.5 on the first grab.
Nice.
Alright, so SpO2 is not really improving with all this oxygen. So, curious if that's just a result of his metabolic state.
His blood pressure is 85 over 54. Heart rate is 136.
Okay. Looks like we got most of our plasma in.
Yeah, it's done.
It's done? Okay. Let's swap it out for some red blood cells and I'll start the attempt. Just want to make sure we're getting as much support in him before we start jamming things down his throat, even though we're not giving the meds.
Blood cells are started.
Perfect. I will give you this bag. Did you catch a hangnail?
No, I just sliced that.
Find where it does that syringe.
He does have end title on the bag there. Yeah.
Alright, pull this out. I've got a great view of the quartz there.
Okay.
Confirmed we're past, we're at 22.
Alright.
Good. Looks like we still have capno going. Perfect. Alright, now for the real doozy, Carly. Didn't listen to lung sounds on the scene, so we're going to have to do this by tactile. I know.
Okay.
Shelly can tell you that has been a repeated problem, so I should probably fix that
So,
immediately.
you're saying it's a pattern?
It's a pattern. I had it corrected for a little while, but you got me nervous, I assume.
Yeah, we'll beat it into you.
I feel like there's more eyes on the left than the right. Our pressure's still 85 over 54.
They look pretty equal.
I think so. Alright, I'll take your word for it.
That's tricky.
You're gonna set up the vent so you can give your hand a rest.
Sure. Turn it on.
Back for you.
What you looking for?
Getting some calcium gluconate going. Since we're on our second unit.
I like it. All right,
Ready?
we're ready.
If you can get on the top of that med bag, let's also get 100 of fentanyl.
100 of fentanyl.
Even better as a pre-treatment, kind of as an afterthought there since he's got a head injury.
Sure.
But like some pain management is still a good idea even though we got a GCS of 3.
Yeah, perfect.
Here, let's
100 of fentanyl, is that what you said?
yeah. Do you need a syringe?
No, I got it.
So go. Perfect.
All right, 100 of fentanyl is given.
Thank you. Gotta borrow one of his fakes. I feel bad. Okay. This is disconnect on patient side.
It's not. It's the. You're good. Keep going.
Okay. For safety. Alright.
Had a test long and now I've lost it after I fixed it.
Those are calcium gluconate.
Calcium gluconate,
1 gram.
1 gram. Got it.
Like I said, we considered TXA, but with his downtime, I don't think it's going to help him any.
Okay. Calcium is in.
So we're supporting his blood loss, got his airway under control. Blood pressure's looking slightly better.
Okay.
Vitals 32. Obviously we had him at 100%, but since we're not connected to oxygen.
Yep. Let's see.
32.
Tourniquet still looks good.
Okay. Is that hip wound?
Here, I'll let you look at it. Check it out.
Oh, good. You had some gauze on it. So we'll pack that as tight as it will pack if it's not already packed. I think all our sources of bleeding are pretty well under control. We just didn't get a good look at his back because he's on the backboard.
Sure.
All the pools of blood I'm seeing so far are consistent with our findings. So, good oxygen. We've got air in and out, blood round and round.
Okay.
Basics to keep them stable. Should we call in a report to the hospital?
No. I think we're still like 15 minutes out.
I don't think we got any demographics off of first responders, so we'll have to.
No, it'll be the same. 30's male.
Yeah.
His belly was soft? I don't remember.
I feel like it was. Yeah.
Yeah, it's soft.
Some direct pressure here for a little while
It felt a little crunchy when I pushed on the.
on the pelvis.
When I was doing the pressure on the wound, at least. Yeah.
Okay, we can wrap them up. And grab the pelvic binder out of that blue bag next to you. Let's feed from your side since you got more room.
All right. Honestly, these seatbelts might have had his pelvis stable. We had him on
Probably
there.
might be doing more harm than good now. just snug. It doesn't have to be super tight.
Okay.
Alright, anything else you haven't seen us addressed that you'd like to see addressed?
No, I think we're done.
Alright.
Alright, sweet.
Wash my face with the bloody hands.
No, I know. I put my hand in there and I don't know what's wet, but it's all over me. Alright, anything you want to do different, take back, add?
Lung sound before we took off. That would have been fantastic.
Sure, sure. You had a plan for that. It
Yeah.
worked.
Thinking about the pelvic binder more often might be a good idea.
Sure.
So we're not struggling like that to find space.
Yeah, that's valid.
Did you give any RSI drugs?
No, he had a
I see, I
GCS
couldn't
of
hear.
3,
I
and
couldn't
so he
hear
was like,
anything.
I think we're going to use that for sedation.
And I'm like, wait, did he already intubate?
Yeah.
So I came out and I just couldn't hear you back there.
No problem. Pelvic binders, I mean, you can go all over the place with them. I am a fan, if I'm going to a motorcycle accident, I just bring it with me. Because their chances of a pelvic injury are pretty much sky high. Because
Right.
you have that tank right between your legs, so if they've stopped suddenly, like the pelvis that's what goes first. So
Gotcha.
that's just me. I'm not saying that's how everybody needs to do it. That's just what I like to do. As far as that goes, I have absolutely also put them on in the aircraft. You know what I mean? So that's just put it in your tank. I think your scene time was awesome. Like, get out of there. We know that this is not where we need to be. LMA, I loved it. He was not appropriate to tube yet. He is tricky in that, like, even when we did tube him, he still had that blood pressure in the 80s. You're like, oof. If your LMA is working, you could go back and forth. We didn't give any meds, so there's also that. You know, the meds weren't going to take him down. You can always bagel him out, of course, putting that tube down the back of the throat. But no, I thought it was good. I thought we were spot on.
Sweet.
You can, just for your own knowledge, you can put the LMA on the vent. I've been able to do it and not had any problems.
Nice.
I'm sure someone will also tell you that, no, you can't do that, and they always have problems, so I don't know. It's worth a shot to get hands-free, I guess.
Probably just depends on your pressure setting, really.
Right. And what kind of seal you had.
Yeah.
Which, if it's a good seal, then it shouldn't matter, in theory.
Yeah. Some IGL company says that they cannot tolerate being on vent because of the pressures.
That's why we don't use IGL. I don't like that. But the reason I know that LMAs will work is we use them in surgery daily, and they're on a vent, right? Like, they're not getting bagged the whole time.
Oh, I'm still really good at making a mess.
Perfect.
Okay.
You were raising
Yeah.
foot.
I'm gonna grab the handle first.
Sure. I'd be a lot more productive.
Right.
That's that.
Hold on.
So this
Please.
other book I've got, it's got too much stuff on it.
Yeah.
Waste time.
You know what I'm bagging for?
Do what?
Was this supposed to, did you want to put your bag?
Years ago when Monette was in the city, the hospital was in the city, we would go to get an inpatient. They'd bag them from the house down in town
Jesus.
because they didn't want to clean the vent when they were done.
Oh, how lazy.
I about fell up. On my first ones.
You're good on the oxygen. You can leave it back there.
Good
catch, good guess.
Yeah, they're sure. Yeah.
Is it okay? It just vibrated a lot.
All right. Yeah, exactly. Yeah, I didn't even catch you doing that first. I don't have that.
So long.
Just,
Well, one more.
all right.
Willpower's pretty strong, that's all for that. I haven't taken.
Alright, recap, 63, Alderman status, fever, Barton County, back to COX South, multiple drips, vent. Alright. Hello.
Hey.
Yes, we did.
Oh,
Didn't want to carry it twice.
what's up? How are you?
I'm doing alright, how are you?
I'm okay. So this is Andy Johnson, 63 years old. He came in complaining of severe belly pain and telling us about coffee ground emesis. Took him to CT. He has severe diverticulitis. You're going to take him to South for emergent surgery. He actually became altered. The doc decided to intubate him. So he's got a 7.5 tube that's 24 at the teeth, and he got back about 45 minutes ago. RT went to go get a vent. It was malfunctioning, so that's why I'm bagging.
Sure.
So we have 3 drips going. Right now we have them on octreotide that's going at 30 mics an hour. Sorry. Dopamine's going at 5 mics per kg per minute. And then the propofol is going at 22 mils an hour. This is Foley. He has an R line on the left here. and EKG's fine. I've got 3 right here.
Do you have any of these labs or other
Yeah,
paperwork?
there's a few labs for you. There's also an order for bank. He hasn't had that yet, but I'll send it with you. And he's had 2,000 mils of normal saline, which he just finished.
2,000.
Yeah. He's really hard to bag, actually. I don't know what that's about, but it definitely feels some resistance there. So vital signs. His vitals are 70 over 40. His heart rate's 130, 90%. Well, you see it now you're on your monitor, but and temperature's 95.5.
Okay. I hear lung sounds on the right side. You said your blood pulse was supposed to be at 22?
It is, yeah.
Okay. Is that 2.2? That's the
Oh, yeah, that's my fault. Sorry.
That's okay.
Got stuck a decimal in there.
Does he
So,
respond at all force?
I mean, his eyes aren't completely closed. He's not really fighting anything, but
Okay.
yeah, I would say he's not fully sedated, but pressure's so soft.
That's all right. We'll work on it. Let's do your syringe over here.
Okay.
Bring back your tube up just a little bit.
Okay.
So I think we're probably too deep.
Speak up.
I'm going to back up the tube because I think we're probably too deep. Only had lung sounds on the right side.
Alright.
Excellent.
Should do that more often.
Speak up.
Yeah.
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 See, the number's too great.
It's a little dark in this hospital.
Yeah. Okay, now we're at 21. Get the pump switched over for us.
Yeah, I got the Octria tied. I didn't know what
Perfect. Let's
else to do.
skip the propofol for now since the pressure's so soft.
Turn it off.
Yeah.
Okay. And then we've got, it looks like dopamine is going.
Let's go. I'm gonna grab her. No, we got Narcan. Do you have any other medical history towards the divers?
Peptic ulcer disease, TIA, I believe, and diverticulitis.
And cardiac issues that we know of?
Not that I know of. No, he's allergic to amoxicillin.
Okay. Dopamine is going at 5 mics per kilo per minute, it looks like.
Before you start that, how do you feel about switching to Levo?
Give me that.
Something like Levo.
Switch him to what?
We're gonna switch to Levo.
Okay, I have some right here if you like
Perfect.
it. I'm pretty
Chicken
handy.
already.
I mean,
That is.
Here. You do this one. Get this one.
this is your bank. I'm gonna send that with you. It's ordered but not given. Okay. Oop. Hello.
Bigger issues.
I can draw it up how much if you want.
Just 100.
Alright. Hundred of ketamine. Are you ready for that now?
Yeah, since we took the propofol off, just keep them sedated.
Alright. 100 of ketamine is in there.
the next thing. You're welcome to listen for me if you don't mind.
Sure. Alright. Can you confirm bilateral lung sounds?
Thank you.
Yep.
I've got 8 milligram at 250, ready for 10 mics in a minute.
Yeah, heart rate.
I'll tell the pump 240. I'm going to be confused.
Yeah. That's not too, but me looking at you.
Oh.
I was like,
Good.
I think I forgot to tell you, he's had, he has an NG tube and I've gotten 900 out of coffee ground emesis.
All right. I'm sure his hemoglobin's recorded. I just had to take a moment to look
It's
at it.
on the labs there.
Thank you.
Takes an aspirin at home. Looks like white count was 28, platelets are 100, lactate is 4, sodium's 145, potassium 4, creatinine 2.2, BUN is 30. Blood gas was 7.28 for pH. PaO2 is 55, CO2 was 60, and then bicarb was, bicarb was 14, excuse me.
I think hemoglobin 6.
Hemoglobin, yeah,
Yeah.
6, macro was 29.
We'll let some transfusions go in the helicopter. Alright, it is flowing.
What's your levo going at? Sorry.
That's
I started him at 10 mics a minute.
10, okay.
okay.
It's fine, just
Pressure.
be alright.
Alright, I got it
we
just
got it.
turned on. Are you ready to, or did you want anything different?
No, we'll see how it does in those settings and adjust as needed.
Okay.
Give them more basics.
Ready?
Yep, there you go. Do you have the dopamine, or what do we do with that?
We've got to stop right now.
It's
Stop
stopped,
it. Alright,
okay.
perfect. Maybe we'll stop it then.
You have to remind me how fast is the document, the bank running in? Is this
Yeah,
Hours or
like
minutes?
over an hour is usually
Okay.
what we.
if it was 30 minutes, an hour, or 2 hours?
Definitely not 3 minutes.
Definitely not 3.
That's called red man syndrome, and that's a whole new problem. Thank you, Chris. Yeah.
Where's this? Oh, the art line. Here's your, you have an art line. Just one more,
Yeah,
one more thing.
One thing we'll
There's
do
a
that.
Foley on that side as well. When we move him, you'll wanna.
You'll get that cable ready to hook up to this.
Yeah.
Gonna get this pumped up to 300 so we can start monitoring that.
All right, your heart rate's still 130, blood pressure improved 104/64, 96%.
Perfect.
You can just call it 300.
Yep.
This is gonna take a minute.
Yeah, it's
Okay, call it 300. Look at that, first try. Transducer here. You got any tape on you?
Yes.
Perfect. Scoot that down a bit. And that should keep us at the float stack line there.
All right.
Take that at a weird angle now. Oh,
just brutal on it.
Yeah. It's doing so well,
I
too.
know.
so I'm gonna do now is I'm gonna switch this off for the patient so we can get a new zero. See. Well,
What?
kind of need this hanging to get an adequate zero.
No.
Leave it right there. We'll just re-zero it once we get hung up in the aircraft. I'd like to get a sneak peek. You mind a zero? for me?
Ready? Zeroing. Zeroed.
Perfect.
All right.
Very good.
You need lift help?
You need extra assistance.
I can hold something if you need me
Just don't
to.
want anything to
Okay.
well, not here. We wouldn't do this in real life.
Hold that on your chest, sir.
Hold that.
Okay.
You got one hand there and I
Y'all
got one
ready?
hand here.
What's the high pressure alarm for?
All right, 1, 2, 3. Okay, we're gonna go south a little bit. His head's hanging off. There we go. One more. Another little pull. Hook. There we go.
All right, that's good.
Okay.
Where are we? Cox North? Where are we here?
Right. Thank you for your help.
Yeah,
Thanks for being so patient with us.
it's all right. It's the most exciting thing I've done all day.
All right.
Okay.
You got that.
Yep.
Onward. something.
Okay, so as Carly gets crawled up in there, she can take those from me. Just, there we go.
Get out of your way.
For the vent. Okay.
Ready?
Nice. See? You're learning already.
Yeah.
Hold that just for a second.
Yeah.
There we go. All right. That's
Alright, we've been oxygenating well. Get some cap now thrown on to him if you want.
Okay.
Get some blood tubing ready.
blood tubing.
You good with me opening this one?
No. We'll put in that bag, please. Oh, because we've already opened one today.
I see. It's just so handy.
It is. It is.
We leave our airway bag on scene? Looks like it.
Possibly.
Are you gonna be good for a minute?
Yeah, go ahead. Stand by. I'll flip over the camera.
I remember what I was doing for a moment.
Capnography.
Somebody really likes that weed for that.
Yeah, for sure.
I think I'll like it more once we get a little more blood volume in them.
All right. Your plasma is going.
Looks like everything's flowing really well.
Yes.
Keep it easy to monitor.
Yeah.
At least for you anyways.
I'll give it to you. All right.
Alright. Did you make it out with this paperwork?
I have it memorized. What do you want to know?
Perfect.
It
Think
is
we're
somewhere
laying on
in
top of
here.
them. Yeah. Let's see. I don't remember his ABG right off the top of my head. I'm willing to bet he's acidotic.
Yes,
Just because of his condition.
sure is.
So let's increase his respiratory rate to 20. Let's see if we can't get his entitled down to 35.
Okay. Respirations to 20.
Just be a little messy about things, nitpicky. So we got blood going, we've got him oxygenated really well. We've got his map up where I want it. Probably want a stable position here. The art line is gotta wait for it. I don't necessarily see a reading off of it. Ah,
Stunning.
thank you. Sweet. So our cuff pressure is accurate. Let's see, corrected the tube. Getting blood in him for slow hemoglobin. Looks like he's tolerating our vent settings really well. Can you think of anything?
Off the top of my head. Oh. I got shit in my pockets.
Oh yeah, let's get that vent going. 25.
Alright, your scenario is complete.
Sweet.
That's what we're headed to next. Good for me. Alright.
Alright.
Anything you want to keep, take away?
I haven't done a lot of transfers, so this one was just a little rocky.
Get ready to
I
live.
feel like we addressed all of the significant stuff.
Mm-hmm.
So,
Yeah.
yeah.
Agreed. I think you're fine to switch over to Levo. Why not stay on dopamine or increase it? Like, what's
Other
your
than just
thinking?
personal choice, because I know it's toxic to the heart. I've never, anecdotally in the field, have never had great luck with dopamine.
Sure.
I keep hearing levofed's a wonder drug, so I'm like, he's already on the low end of dopamine. Why not just switch him over?
Okay. Yep.
Prevent ourselves some VTAC down the line.
What was his heart rate?
130.
130.
Yeah.
And then what's the big side effect of dopamine?
It's going to increase that heart rate.
Thing, right? So like that already makes it, and like you said, it's already a low dose, so that kind of already makes it like, I wouldn't mind to switch over early since we're set at the early part of that.
Right.
One thing with him is like he's septic also, right, with everything, and septic almost first. He does have the bleeding going on as well. How much fluid did he have?
2,000.
2,000, and he was 100 kilos. So what would be like the appropriate sepsis fluid?
3,000.
3,000.
Yeah.
Okay, so adding another liter wouldn't be a bad idea. And then the blood obviously as well.
Right.
At the end of the day, it's still fluids and then blood, as far as I know, in the sepsis
Oh, okay.
campaign. As far as sepsis goes, this one is tricky because they're also bleeding. We know that because we have all this coffee ground emesis in that box. So
Right.
we just brought it up with other candidates, so I thought I'd bring it up. It's tricky because you're fighting multiple things at once. That's what we do.
Yeah, that's why we're here.
Yeah. Okay, sweet.
So you're telling me this liter doesn't count?
It
The
does
one
not.
that never goes in?
Yeah, right, the one that just hangs there. It sure does not. Okay, sweet. We will reset. Go from there.
Junk already?
Yes.